tonight, mental health professionals in Kansas City say too many people are waiting too long to get help during the pandemic. Good evening. I'm Haley Harrison. As COVID-19 cases surge, anxiety is high. KMBC 9's Brian Johnson reports there is help.
Academic and financial pressures.
This is an embarrassment to our country.
Political anxiety, COVID-19 concerns. Each and every person's mental health is under pressure right now.
The totality of it all is hard.
Dr. Danielle Johnson is a psychologist at the University of Kansas Marillac campus.
I am definitely seeing more kiddos that are struggling with virtual schooling. Even for the high school kids that are in the hybrid model, they are really struggling with not being in school. And we know mental health wise, kids do better in school.
She says during COVID-19, people are waiting too long to get help.
Clinically speaking, I'm seeing everyone probably ages 14 and up that are really struggling with the impact, how it's impacted them.
3 groups are the most at risk: women ages 15 to 24, seniors, and white men ages 34 to 54.
Which is why it's really important for all of us to be looking out for the warning signs.
Exercise, sleep, healthy foods are key. Equally important are wearing masks and other COVID-19 precautions, especially during the holidays.
Yeah, I think we are trying to make these things dichotomies, either or, and they're not either or, they're ands.
Life is different, but it can still have joy. Brian Johnson, KMBC 9 News.
Hard numbers on suicide and mental health lag behind 2 years, so we don't really know what's happening right at this moment, though. The National Suicide Prevention Hotline is 1-800-273-8255. Well, tonight, Clinton High School will move all virtual starting tomorrow, and it's going to continue through November 20th. Today, the district reported 31 total active COVID cases across several schools. The superintendent of this small district wrote in a letter saying it is becoming increasingly more difficult to maintain in-seat instruction at our schools, and especially at the high school. Liberty Public Schools could go 100% virtual if COVID-19 cases continue to rise. The superintendent there sent a letter to families saying that they should all be prepared for that transition. Right now, pre-K through 5th grade are in all in-person classes with the option of virtual learning. 6th through 12th grades are on a hybrid learning schedule. Well, the president of the Missouri State High School Activities Association says that the board is evaluating what winter sports will look like in the pandemic. Dr. Daniel Clemens says playing indoors can be a lot more difficult.
If we have an outbreak, we'll shut it down. And then if we are able to build it back, we'll do that. We may not be able to compete at times, but we'll still be able to practice, or we may not be able to practice. So it's going to kind of be an ebb and flow type thing through the season.
Missouri state education officials say enrollment dropped 3.2% in public schools this year. That's a drop of more than 27,000 students. And a spokeswoman for the Missouri State Department of Education says that officials are trying to determine if the students who left are homeschooling, if they're attending a private school, or if they simply have not enrolled yet. All right, tonight we are tracking the coronavirus in our area here in Kansas City. More than 1,000 new cases were reported in the metro, in Kansas City, Missouri alone last week. There have been 12 new deaths since last week. And here's a look at the totals across the 9-county area. This is the metro since this pandemic began. The highest numbers remain in Kansas City, Missouri, and in Johnson County, Kansas. The biggest hospitals in the metro are reporting record numbers of new COVID-19 patients. The St. Luke's Health System has 149 patients. There's 78 within the University of Kansas Health System and 40 at Truman. Hospitals across Kansas City have several staff members either diagnosed with COVID or in quarantine. Some say they don't have staff to support all their beds.
We're really worried about our staffing levels and being able to take care of people.
Hospital officials say if the need continues to grow, they will have to cancel essential surgeries like open heart or cancer surgeries, and they urge people to get a flu vaccine to reduce the strain on their hospitals.